Welcome to the Mug Hub podcast, the ultimate platform for all things related to medicine's use, patient care, and the incredible world of pharmacy. We are your hosts, Connor and Sian, and we're thrilled to have you join us today.
Here at the Mug Hub podcast, we're passionate about empowering future pharmacists, expanding your knowledge and igniting your curiosity. Whether you're a first year embarking on your pharmacy journey or a final year getting ready to go out into practice, this podcast is designed just for you.
Across our series, we delve into 4 captivating themes that will take you on an enlightening and entertaining journey. From exploring intriguing clinical topics to showcasing the extraordinary individuals who make up our incredible teams, we're here to unlock the secrets of the pharmacy world.
So grab your favourite mug, settle in, and let's embark on an incredible voyage together. Get ready to be inspired, educated, and motivated as we unlock the vast potential of pharmacy and the vital role it plays in healthcare. Welcome to another episode of the Mug Hub podcast. And today we are joined by 2 of our lovely second year students, Marth and Veronia.
Nice to meet you.
Nice to meet you.
Thanks for having us.
Thank you for coming in. I'm hoping you can talk to us a little bit today about how year 1 was for you. And I guess I want to start with just sort of general. How was year 1 and how prepared did you feel for exams at the end of the year?
Do you want to go first or me?
Yeah, sure.
Okay.
So it was a hard experience, different experience.
Different,
sure.
Yeah.
Especially if you're coming from A level, if you're coming from foundation year, if you're coming from a gap year, it's going to be different, and it's normal. It is also normal to find ways to adapt, especially in the first couple of months.
Okay.
It's absolutely normal.
Yeah.
But yeah, it's going to get better as you go along. You're going to find strategies on how to adapt better at uni. You're going to find strategies on how to revise for exams. And at the end, you'll feel happy.
Okay, a nice positive end.
Yeah.
It sounds like you might have had a couple of challenges along the way then. Have you got anything that you'd like to share with us in terms of what you've adapted to?
Yes, so actually a couple of challenges. So the first challenge was actually finding ways to revise. So I was at the beginning, I was just making notes, coming to the lecture, listening to the lecture, and then just making notes in my notebook. But then I was nothing is being processed. So I had to find a couple of ways on how to revise better. And also I had problems with the commutes. So
Where were you commuting from?
I was commuting from North London.
Okay.
So,
Yeah. That's a journey. Was that cutting through London and then getting a train?
Yes.
Yeah. So that can take a while.
Can take a while.
And that's tricky when you've got a 9 o'clock start.
It is, yeah. I had to wake up at 5:30.
Oh,
Wow.
exactly.
Did you move then? Is that what's
Yeah.
fine.
Now I moved, so I'm
Okay.
happy.
Yeah, good for you.
For me, the challenge was lab reports because I came from A levels, so I did gap year. So I did like A gap year, but then in the gap year, I revised some science in there. So the science was not the challenging part. For me, it was the lab reports, like how to write it, the structure of the lab report. We were not taught how to do lab reports before.
So in your A
school.
levels, you did you do science-based subjects?
Yeah, but then we didn't have lab reports for it.
Okay.
We just had the lectures. We didn't have lab reports. So like, I didn't know how to reference. I didn't know like if I need references for graphs, for like images in the lab report itself, and then like how to like count the words itself. So like I remember asking my tutor a lot of questions about the word count. Like, does the characters count? Does the title count? Does the references count? So yeah, I think maybe the mentorship scheme that we're doing right now, like for the farm family, that would be helpful because us year 2s can teach year 1s how to like write a lab report, because obviously they can ask their tutor, but then like mentor to mentee, like peer-to-peer, it would be easier, less tension.
So you involved in that peer-to-peer scheme? Brilliant, yeah.
And is that Dr. Laura Hunt?
It is.
Yeah.
I had to get her on for
Oh, we do.
to promote the what is it called?
Farm family.
Farm family. You know who's going to be so jealous of that?
Yes.
Claire.
Well,
Claire
she might have
May.
had a hand in
She made,
the naming.
so you know Claire May. She has long spoken about having a family, which is so cute. But we
Yeah.
also kind of tease her about it.
Well, we shooed it away, didn't we? When
We did
went
shoot
with
it away.
Malcolm?
But yeah, that's a great scheme because obviously when you start at the university, there are loads of different rules and regulations about word counts and referencing style. And yeah, why should you know? Why should you know? Were there resources online that helped you with learning about those kinds of things? Or was it mostly asking your tutor?
There were some resources that the library offers. So there's EndNotes. So it's if you go to the shared link and if you go to library, you'll find referencing resources.
Yeah.
And EndNote is one of them. So you can install that on your laptop, or if you're finding difficulties, you can always. There are always like emails to email. So it's basically linking that software to your laptop, and if you find a website, you can just put the website, download it, and put it on EndNotes, and then all you have to do is click on Word, and that will do the reference for you.
I love
EndNote. I was going to say, do you use it?
I love EndNote, and I didn't find out about EndNote until I did my MSc. So all the way through my undergraduate, we did the old school
I still do old school.
writing out reference. If you plug in another reference further up in something you're writing, you have to renumber everything.
I know.
EndNote does it for you.
Well,
I guess the plug is you get as students a free EndNote,
Yes,
so don't
you do.
pay for it.
Yeah.
If you go through the library, you get EndNote for free. That was my plug. Sorry.
no, nice. I'll also plug something because I think that there is it the Study Skills Hub? Is there a Study Skills
Yes,
Hub
yes.
online?
Yeah.
So that
Yeah.
also has lots of good stuff on what plagiarism is and referencing style
Yeah.
for those of us who don't use EndNote.
So actually, I didn't use EndNote. So I asked a friend in year 3, and she gave me a website called MyBib. So
I've
So,
heard
like,
of that. Yeah,
it gives you the
MyBib.
reference you want.
Yeah.
So either Vancouver or Harvard or any other style that you want, and then you just copy paste the link of the website, and voila, you have that.
La
You
voila.
have it. It's like, it saves time,
Yeah.
and it saved my life in year 1. Let's
Okay.
put it that way.
Yeah, that's big then.
Yeah.
Thinking about the exams, because I wanted to focus a little bit on about how you prepared for the written exams and the OSCEs in particular, because that presumably was a new thing for you to do an OSCE.
Yeah.
Were there any strategies that you used that were helpful in terms of preparing for exams?
Yeah, I can talk about the written exam.
Go ahead, yeah.
I did talk about in the beginning about writing notes, which did not help. So I would go. So it is fine.
Which is weird, isn't it? Because
Yeah.
you'd think that that's the classic. Writing notes on your lecture notes is the way to revise, but no.
Yeah. So I realized that mid-November, and it's okay to realize it at that point.
Yeah.
It's where the trial and error is. So you can start using lots of various things, but what worked for me is something called Anki. So Anki cards.
Oh, yeah.
Yeah.
They like little
What these
revision
are?
cards, and you can
Yeah.
write
Yeah,
questions.
it's
for
like
things.
electronic revision cards. So you write your title, your question,
Yeah.
and then if you flip it, so you answer the question in your head, you flip it and you see the answer. It's like a Feynman technique kind of
Okay,
way. So
yeah.
you teach yourself that
Yeah.
topic, and then you say it to yourself, active recall. That's it.
How are we spelling this?
Anki. So Anki.
Yeah.
Does that stand for something?
I don't think so. No.
Okay. All right. That's good. So the Anki method. Yeah.
And also something to add on the Anki method is that you can grade yourself. So you can grade yourself on fail, good, I think, very good, and then excellent,
Excellent.
something like that.
Yeah.
And then it works in an AI method that the stuff that you failed on, it will start to focus more on it, and the stuff that you did good, maybe less on it.
Yeah.
So it's
That
it's
sounds really
good, yeah.
useful.
It was a lifesaver.
Yeah,
for my
yeah.
exams.
Sounds like it. And you discovered that around November.
I discovered that. Right, I knew about it earlier, but I didn't use it until mid-November.
Well, I'm only learning about it now. I'm reaching the end of my career. So
And in terms of, remind me, can you share decks of?
Yeah.
So have you done that? Are there other people and
we
you've
did it in
all
our
shared?
group. Yeah. So basically,
How
someone
cute is this?
puts
So cute.
someone puts all the MCQs into one Anki, and then you share it, and then people can like do the MCQs and then see if they got it wrong or right, and then you get graded on it.
Yeah.
Basically.
I like it.
Yeah.
Little support network as well. Nice. What other strategies did you come across? Or like thinking about OSCEs, how did you prepare for OSCEs?
For me, preparing it, I use my family as the lab rats.
Lab rat family.
So I use my sister as like the patient that is angry.
Okay.
Okay, so the patient that
Is
wants
she an
everything.
angry sister generally?
No, but she wants to be a lawyer, so that is a good practice for her.
Perfect. Yeah,
You know?
good role play.
And then I use my mom as the worried patient, the one that is always worried about everything, that questions everything, that you need to have answers prepared for everything. And then my dad is like the chill person. So like the person that just comes in, takes his medication, or has a question about something and goes out. So that is how I used it.
And so what did you do? Did you set up little case scenarios that you would role play with them?
Yeah, so my mom, bless her, has every over-the-counter medication.
Okay.
So I would take one, say the mechanism of action to her. So I would give her the flashcard for it. So recite it to her, and then she would tell me if I missed anything.
Yeah.
And then, for example, because the doctors, most of them, they would have the blood pressure thing, they would have the oxygen saturation. So I just used it. I used the equipment, the stethoscope, and
And did that build your confidence then for the actual exam?
Yeah.
Yeah. What a great
and
idea.
Also the workshops we did. It built my confidence with speaking with other people. Also because like we had the workshop last year where we had to call the surgery and tell them that the medication is contraindicated with something and we need to change it. Yeah. And also they grouped us not according to the people we feel comfortable with, people we don't feel comfortable with, or like we never talk to them. So it's like out of our comfort zone, but at the same time, it gave me the confidence skill. That is something I lack completely.
Yeah.
So yeah.
You lack confidence.
Yeah.
You don't come across that way.
I don't come across it because I put a layer.
Yeah.
Let's put it that way.
Well, and maybe that's something to think about with the OSCEs as well, because we have to sort of recognise it is a false scenario. So it is kind of acting a bit, isn't it? So maybe that practising and doing the role plays with your family members helps build up that
layer. Yeah.
That layer.
Professional character that you're
Yes. Playing? Yes.
So you ran, because you're the module leader for the clinical and professional skills, you ran the additional sessions for them to prep for OSCEs. Did you go to those and did you find them useful?
Yeah, very useful.
Yeah, so the OSCE prep sessions, good. Because I don't know, what do you think? Is it like with the skill, just practicing it more is helpful?
Yeah, it was very helpful because also I think you provided active patients during that point. So it was nice to see actual patients and then test.
It was Veronia's family.
Yeah.
Actual patients.
But so we practiced on the active patient, and I think that built up my confidence in my OSCE. And
Good.
Also because when we did the OSCE the first time, it was 1 month before the final exam, the OSCE exam. So like we had a gap of 1 month. So like to remember, so specific ones were like accuracy checking, like the legal and the clinical part of a prescription. That one, most of the people like I talked to, we forgot about it. So when you did
because you'd learnt it all the way back in October.
And it's like a minor thing. So like you don't, because you already know it, like how to accuracy check. So if you're working in a pharmacy or you've seen it before, like you know the process, so you don't actually go and revise it again. But then when you did the workshops again, that touched it on us. That was amazing.
Brilliant. But you also had the placements in between where hopefully some of those processes were being seen again. But I guess it's less structured and there'd be more variability.
Yeah.
Hopefully,
But I do think that if you're more interacted in the placement and you ask your supervisor, I'm doing my OSCE in a couple of months and it's involved accuracy checking, can you help me with that? Can you give me actual prescription and see if I can find any errors?
Oh, good idea.
So, that would help.
Yeah. Oh, loads of good strategies here to help. Bet you wish you had somebody telling you this last year.
Are there any other pearls of wisdom you want to impart on the current first years in preparing for written and OSCE assessments?
Do you want to go written or OSCE?
Do you want to go first?
Okay, so I'll go for the OSCE one. I would say not to be nervous because, well, as year ones for me, it was the first time I did an OSCE in my entire life. So I was a bit nervous, teeny tiny nervous, just a teeny tiny bit.
Yeah.
So yeah, and if you have any questions during the workshops, just say it. Even if you pester the teachers, it's fine.
yeah.
You'll do a fine pharmacist at the end, so it's fine.
It's what we're there for.
It is.
Yeah.
It is what we're there for. Yeah.
Yeah. So I'd say don't be nervous, ask questions a lot, and active recall method. These 3 are the best for OSCEs so far.
Yeah.
They worked for me. I don't know about the rest, but yeah.
Good.
Yeah.
Nice.
I think these are very good for the OSCE. In terms of exams, I would say try and be more engaged in the lectures. So try and pay attention to the lectures. If there's anything you don't understand, it's not a shame to go to the lecturer and ask questions. Oh, I did not understand this. It's
Yeah.
actually a very positive thing to do. So don't be shy. Just go and ask that question, because that can actually make a difference in the exam. And
Yeah.
because if you ask that question, it will be remembered when you're sitting in the exam room on the exam paper. Oh, I did ask the lecturer about this. You write about it.
That's
So,
back to that sort of active learning,
Yes.
isn't it, as
Yeah.
well? You've taken an active role. And it's reminded me, if I can just say something,
Go on.
just to deviate a little
Go
bit. The head teacher in my boys' primary school at the time had this thing, this acronym for this teaching philosophy that he had, and it was called JONK, and it stood for Joy of Not Knowing. And it was, which I loved, and it was
Yeah.
basically encouraging children to feel happy when you don't know something, because it means that you're on the brink of learning something.
Yeah.
And I just love that, and I think that we should don't smirk at me, young man. That we could do well by carrying that forward into secondary education, higher education, life. It's it's really all too easy to sort of say, oh, I shouldn't ask that, I should know that.
Yeah.
But brilliant, you don't know something, you're about to find it out.
Yeah. Also, something that helped me in year 1 was that the ones that had mechanism of action, the drugs, it was easy for me to like draw diagrams of it. So like this, it inhibits this, which inhibits this, so like a flow diagram.
Yeah.
So then when I go into like the exam, I remember what I like did the flow diagram, like writing it out instead of just reading it on the screen. So like physical pen to physical
Yeah.
pen, basically.
Yeah.
Again, that's that active thing, is you
Yeah.
Yeah.
rewriting it in a way that you'll remember it.
Yeah.
Fantastic.
And even if you just draw anything, if you like, just to add on your method, in terms of mechanism of action, like let's say you have pancreas, you can draw anything for that pancreas, like an X, for example.
Pancake.
Yeah, no, not a pancake, but, but like kind of a diagram just to help you learn it more.
Yeah.
And not just, you can do a flow chart, but you can also put your own drawings. It doesn't matter if it's ugly, you just draw it, and then that will help you.
No, yeah. So and maybe testing out a few different methods.
Yeah.
So knowing
Yeah.
what's going to stick in your brain. It's for you it might be pictures. For you might be writing a song that you're then singing in the exam. You're not allowed to sing in the exam, so don't do that.
I remember some people that I talked to in year 3, they used to have like acronyms for every single mechanism.
Yeah.
They just had acronyms. Their head is like ice. I'm like, okay.
See, I had friends that were all about acronyms when I was an undergrad, and I just couldn't get on board with that.
Oh, really?
It just didn't gel with how my brain
Fair
was
enough,
working.
yeah.
So the current 4th years have a dance to, I think, the A to E assessment.
Do they?
But I know that a dance exists, but they haven't shown me this dance.
This we have to
I
see.
know. And I don't know who to pester a bit more to get this dance. I told them it needs to go on TikTok or something.
Oh, definitely. Brilliant. Anything else you wanted to let us know about year 1 and preparing for exams, or strategies that helped you?
Yeah, I want to add also that, like, you're going to have OSCEs, you're going to have coursework. Just because something come up in the OSCE or the coursework, it doesn't mean that it's not going to come up in the exam. You have to know everything for the exam. And I don't know if I'm allowed to say this, but for example, consultation questions, like using the WAM technique, that can be an exam question, and that can come up in the exam. Yeah.
Yeah, no, that's a fair point to make, and I think that there might be a tendency to try to secularize things that's going to only come up here, but
Also, I'd say time management as a conclusion thing.
Yeah.
Because for this year especially, we have the tutor essay that is due on December, and then everything else is due on May. So if you don't manage your time well, then everything is just everything's just gonna accumulate, and then this leads to burnout and just not enjoying the course in general. So manage time well, prioritize stuff. Yeah. What goes first, what goes second, what goes with exams well. So like maybe if you do a certain coursework, it could be revision for your exams as well. So
good point. And recognizing that deadlines are deadlines. It's not a recommended this is the only time that you can work on this, but it's the final date at which it has to be submitted.
But also like give it mental health, so like giving rest to your brain, you know, and like don't overwork yourself. Like you're only human at the end, so like if you're tired today, it's fine, just relax for today and then start again tomorrow. It's better to start fresh than to just go until you burn out.
Definitely.
I was literally going to say be kind to yourself. You literally said what I was going to say is actually we are human. If you're ill for a day or something comes up that you've missed a lecture, you know, catch up with that. But be kind to yourself and realise that you can have off days. Just make sure you come back into it, and actually if you feel overwhelmed, access peer groups, friends, speak to your lecturers and things. So
Can I add something on that?
Absolutely not.
So sometimes you might go to the library, you're burnt out. You go to the library and see a lot of people studying, a lot of people doing work. It doesn't mean that they're doing work, you have to do work. You have to you work on your own time as well. So
Yeah. Good. And just generally don't compare yourself with others. You don't know what's going on. Brilliant.
Fabulous.
Loads of gems that we can take forward about learning and preparing for exams and things. Thank you so much for coming in to talk to us.
Thank you for this.
Thank you for having us.
You're welcome. And that brings us to the end of another captivating episode of the Mug Hub podcast. We hope you enjoyed today's discussion and took away valuable insights that will fuel your passion for pharmacy.
Remember to subscribe to our podcast and stay tuned for future episodes where we continue to explore fascinating clinical topics, introduce you to incredible individuals and enhance your skills to bridge the gap from bench to bedside.
If you've any questions, topic suggestions, or you'd like to get involved, we'd love to hear from you. Connect with us via our social media platforms or send us an email.
Until next time, keep learning, keep exploring, and keep engaging with your studies. Thank you for joining us at the Mug Hub podcast.